A mass exodus of Nigerian medical professionals, care professionals and social workers may be looming. The United Kingdom, which halted visa issuance because of the pandemic, has announced a new health and care visa policy that could attract doctors, nurses and health workers in Nigeria and other countries to strengthen its national health service. The new visa policy aims to make it cheaper, quicker and easier for healthcare professionals to go to the UK beginning from August. Estimates have it that there are over 4,000 Nigerian doctors in the UK spread across 83 subspecialties. Nigeria's Minister of Health, Osaha, has advised doctors seeking to relocate to reconsider, stating that the UK will not pay them hazard allowance. Joining us now from Benin on Skype is Dr. Osaha Abulele. He is the President, Commonwealth Medical Association, and former President, Nigerian Medical Association, as well as the Chief Consultant, Family Physician at the University of Benin Teaching Hospital. Dr. Abulele, it's good to have you join me on the program this morning.
Thank you very much.
Thank you. Yeah. Now, the idea or the issue of Nigerian doctors trooping out for greener pastures, either in the UK, in Canada, or in the United States, or anywhere in Europe for that matter. I know that is not new to you, but there has been a recent incident where so many doctors, about 58 doctors who intended to travel to the UK, were stopped by immigration officials. Talk to us basically about this, because Nigerians are really scared and concerned about this.
Yeah, it's quite unfortunate, but again, not unexpected. Not unexpected in the sense that we have always said that unless and until we put the right infrastructure in place, the right system in place, the right incentives in place, you're going to have a burgeoning increase, a burgeoning phenomenon of brain drain, unrestricted by whatever laws you put on grounds or whatever limitations you put on grounds. So what we are seeing is some level of desperation by those who ordinarily should be in our country to, of course, contribute. But because of the very poor conditions, poor working conditions in our country, they have no choice but to continue to exit our shores. Because, again, you have what we call pull factors from those economies and those countries, pulling them. Even in spite of the pandemic, people are still ready to vote with their legs to those countries. So I do not know why they had this kind of challenge. Was it political, was it diplomatic or whatever? Because I expected that a lot of these logistics ought to have been worked out. And the information I had was that there seemed to have been some level of, understanding between the British authorities and, of course, the Nigerian authorities. But how come it was at the point of departure that it was not suddenly realized that they said they had no visas, even when they had worked out arrangements, of course, to have their visas on arrival, which, of course, we know is usually done if you have that level of understanding and some level of bilateral agreement, in terms of your travel policies and all of that. But in terms of restricting movement, it's going to be very difficult. In fact, as I speak to you now, there are lots of Nigerian professionals who are still trying to look for means of exiting the country. And that is why we've been telling the Nigerian government over the years that unless and until you address what we call the push and the pull factors, the push factors in terms of those infrastructural issues, system issues, working conditions of your own professionals in your own country, you do not expect them to stay here because migration of labor is an international, phenomenon. It's an international issue. And so you cannot restrict them. It's a fundamental right to migrate to wherever they think they are better appreciated, better, able to practice their profession, which, of course, they have undergone in terms of the training and expertise for so many number of years. So you don't want to waste that kind of expertise in your own country, especially when you are not appreciated. I mean, another factor that has increased this is the lack of appreciation and commitment to the development, of course, and growth of the health professionals in our country. I mean, look at the whole clear case of the hazard allowance. It took even a strike action to even get the government to do what they promised to do in terms of increasing the amount of hazard allowance from the very miserable amount of 5,000 naira to what now was provided for as a COVID hazard allowance or incentive. Even that is not still being negotiated. It's still being pressured. They've only gotten 2 months of the promised 3 months, and nobody knows when the 3rd month is going to come. So when you even look at the pay disparity, when you look at the motivational, factors put on ground by those countries and economies, you may not be able to blame the health professionals who have taken a decision to vote with their feet to those countries.
All
I
right.
also need
Now,
to say
Dr.
that
Nambulele, let me interrupt you a little bit. You are the president of the Commonwealth Medical Association. There are so many African countries who are members of the Commonwealth. Share with us what constructive and deliberate attempt you are having to engage with African leaders as a way of drawing attention to the welfare of doctors and the health sector as a whole.
Yeah, thank you very much. Just recently, we submitted, again, another reminder of our earlier proposals, for how to motivate and incentivize healthcare workers in the whole entire Commonwealth, not just in Africa, because it's not only in Africa that you have issues of health, workforce crisis. In fact, in Africa alone, unfortunately, Africa has most of the disease burden in the whole global space. Africa has about 24–25% of the disease burden of the world, but unfortunately has only about 3% of the global health workforce. So the challenge is more in Africa. But be that as it may, there are some other LMIC countries, the low and middle income countries, who are not necessarily African countries that still have this. So we have put all of this together and proposed to their various governments, and also to see how they can better incentivize their workers, because the critical aspect has to do with how you appreciate and motivate these workers. So whether in Uganda, whether in Zambia, whether in Zimbabwe, we are working even through the medical associations in those countries. Because again, we have our members represented as, professional and national medical associations in those various countries. So we act through them, giving them advice, giving them proposals, and a lot of them have been able to engage their governments. But unfortunately, only few have been able to respond even proactively and responsively to some of those proposals. So all we do now is to continually advocate, continually impress on them the need to even do much more to retain their health workers, to develop and retain their health workers, rather than allowing other developed economies to come and poach on their healthcare workforce and, of course, get them out. Because, again, those countries like Britain, for instance, are a bit more proactive. Even as developed as they are, they every day recognize their challenges and they look for solutions, very brilliant solutions to address those challenges. I mean, what could be more brilliant than the new health and care visa policy of the United Kingdom? I mean, you do not begrudge them, because they are doing their bit to see how they can attract the best of professionals from around the world, of course, highly skilled workers, to better their healthcare system. That is a government that thinks. That is a system that thrives. That is a system that is workable. So African governments must also buy into this, rather than the whole, the whole specter of, foreign medical tourism that they've all embarked on, with poor investments in the healthcare environment, with poor investments in the welfare and development of the health workforce. So clearly, we have been doing that for decades now, for years, and of course, we're still doing that as a Commonwealth Medical Association. But the unfortunate thing is that we do not see the kind of responsive approaches that we ought to be seeing in the African economies, in the African countries. And we have not given up on that. We'll continue to engage them. In fact, in the next 2 weeks, we're going to have a Commonwealth conference again to look at the health workforce, the challenges, the roles, expectations, and how we can better develop the health workforce in the entire Commonwealth. That we are arranging very soon, because we just had one webinar which was focused on the clinical case management of COVID-19. So we are moving now to look at the whole issue of the health workforce in the entire Commonwealth, with particular emphasis on those developing low, middle income countries, particularly in Africa, which have a lot of the health workforce challenge in the whole global community.
All right. Now, some experts say that the UK, the health and care visa policy which is prompted partially by the realities of COVID-19, is certainly to take care of the UK's health interest. Now, on the other hand, are you concerned that there could be implications to Nigeria could be on the receiving end of that kind of policy, especially when medical staff and all professionals begin to leave for the UK? Are you concerned what the consequence could be for Nigeria at the end of the day?
Of course, I'm concerned as a Nigerian, but again, I do not begrudge those countries who are putting in place very workable policies to attract the best of professionals. I mean, it's a global engagement. So every country has to put on ground, some pragmatic, proactive, and responsive strategies to attract the best of professionals for their healthcare system, especially if they really understand the essence of health system development in their various countries. I mean, the COVID pandemic has put it beyond any doubt that health is number one. Health is number one. Health remains number one, and health should be given the top priority that it deserves. So for those countries that have so committed themselves to that reality, then they will continue to put on ground the kind of policies and strategies that the UK government is just now employing. So you do not begrudge those countries. So I only expect that the Nigerian government will open our eyes to this reality and think further as to how to put on ground, not only cogitate, but this time as cogitate very pragmatic, proactive, and responsive strategies, especially those that have been so proposed over the years. Because what I always say is that the solutions are on ground in Nigeria. But the unfortunate thing is that we have not been able to commit ourselves to the implementation of the solutions. I mean, when I was president of the Nigerian Medical Association, there is nothing we did not do to canvass for a more, progressive, health workforce policy in our country. But every time you have workers having to struggle, having to pressure, and eventually even go on strike for things that ordinarily should be prepared by the Nigerian government. So I think the challenge is that of government, and not to make a statement as to suggest that because certain allowances are not paid in those countries, they should not go. That is not enough deterrent. That is not enough to limit those health workers from traveling. Because, like I said, there are what we call push factors, those factors that from the source countries are making workers to leave their economies, to leave their countries. And then the pull factors, which prevail in the destination countries that attract those workers to come to their economies. So what is Nigerian government doing to, of course, moderate and, of course, manage those push factors? For instance, the issue of security. If our security, more than anything now, is a propelling factor for workers to leave the country.
Dr. Nabulele,
the issue of infrastructure, the issue of training.
Dr. Osaha Nabulele, we thank you so much for your insight. A mass exodus of Nigerian medical professionals, care professionals, and social workers may be looming, and the United Kingdom, which halted his visa issuance because of the pandemic, has announced a new health and care visa policy that could attract doctors, nurses, and health workers in Nigeria and other countries to strengthen its national health service. The new visa policy aims to make it cheaper, quicker, and easier for healthcare professionals to go to the UK beginning from August. Estimates have it that there are over 4,000 Nigerian doctors in the UK, spread across 83 subspecialties. Nigeria's Minister of Health, Osaha Hanire, has advised doctors seeking to relocate to reconsider, stating that the UK will not pay them hazard allowance. Joining me now from Benin City on Skype is Dr. Osaha Nabulele. He is the President, Commonwealth Medical Association, and the former President of the Nigerian Medical Association, as well as the Chief Consultant Family Physician at the University of Benin Teaching Hospital. Dr. Nabulele, it's good to have you join me on TVC Breakfast. Now,
thank you, Mike.
Thank you. Now, the Minister of Health, Osaha Hanire, is trying to discourage doctors from leaving to the UK. I wonder what you make of his statement to them. One would expect, or one would say that maybe he has something systematic and maybe a plan, a grand plan on how to negotiate to keep the doctors back instead of leaving for the UK. Can you confirm that, or what is your perspective to this?
Well, thank you very much. I honestly would not want to dwell so much on the statement said to have been made by the health minister, because I want to believe that he may not have made that statement. But if he made that statement, then I think it's not really expected from such an officer, because beyond just talking, we expect to see very pragmatic actions on ground, strategies being put on ground, visible plans to, of course, not only grow our health workforce, but to, more importantly, retain them. We do not want to see speeches upon speeches without having very responsive strategies that will, of course, serve as some level of attraction for our healthcare workers to remain in Nigeria beyond just talking, because the whole push and pull factors are very clearly well known to them. We all know what the differences are, the disparities between what obtains in Nigeria and in most other African countries and poor economies. compared to those of the developed economies. And even at that, you find out that those who are even much more developed in terms of their health systems and their economies are even the ones that are even more pragmatic and responsive and proactive in terms of seeing how they can engage more highly skilled professionals from outside their countries to come and beef up their systems. So beyond just talking, we want to see what actions are on ground, what systems are on ground, what strategies are on ground to retain these health workers, to prevent them to, of course, serve as some level of attraction, some level of inspiration, to prevent them from traveling. Otherwise, you're going to have many more beyond the 58 that was reported to have been, prevented from traveling, out of the country, especially now that the restrictions are being relaxed. So this matter is not new, but what is worrisome is that rather than addressing it in a more responsive way, we are seeing, little or nothing being done to prevent this whole burgeoning phenomenon of brain drain. So it's going to be at our loss, at the loss of Africa, because Africa today has a lot of, in fact, over 25% of the disease burden of the global space, of the global health, of the global community, and yet has only about 3% of the health workforce. Africa today spends not more than 1% of its public health spending, public spending on health. Globally, 1% of the global public financing of global health expenditures on health for Africa. And that is poor enough. That is not enough investment in a health system. That is not enough investment in the health workforce. That is not enough investment in infrastructure and other, factors that can serve as, very attractive, platforms for health workers to be retained in their countries.
Dr. Nabulele, there was much talk about the issue of the push factors. Can you enlighten us or refresh our minds what some of these push factors are, so that we can have an understanding of what is pushing doctors away from the country?
Well, in the last 20 years, we've been talking about these same push factors and pull factors, particularly in African countries, to let them know of how they can drive what I call an equipoise between these push and pull factors to serve as some level of, encouragement for their own professionals to remain in their countries. Now, when we talk about push factors, we are basically talking about those objective conditions in the, source countries. Source countries are countries where these professionals are migrating from to other countries which are known as destination countries. So in those source countries like Nigeria and other African countries where you have very, very serious challenge of health workforce crisis because of the continuous migration of the health workers to other countries, we're talking about those factors in those countries that encourage this level of migration. So those are the push factors. So they are pushing them away from those countries to other economies, whereas those other economies or countries are pulling them. So they are generating factors to pull, those professionals from the source countries to their own countries, which are known as the destination countries. So that, in a nutshell, is what a push factor is. So in our country, for instance, in Nigeria, as ditto most other African countries, you're looking at issues of health infrastructure, for instance, the working conditions, for instance, the pay disparities, for instance, the issue of security, the issue of the health system workability and functionality, the issue of the motivational factors on ground. They are not really there compared to those other countries and economies. So how do you tell somebody who is earning less than a tenth or a tenth of the salary of some other person in another country not to migrate when there is no effort to even bridge the gap? How do you tell somebody in a country with very high level of insecurity from migrating? How do you tell somebody in a country that has very poor working conditions for the workers,
all right,
in terms of conditions of service and the workplace environment, from migrating? So migration is an international phenomenon, and no statement is enough to restrict it, apart from putting on ground pragmatic and proactive actions, like the likes of Priti Patel, the likes of Matt Hancock, of the British healthcare system, British system, has done just now.
All right, Dr. Nabulele, certainly from everything you've listed out, Nigerians really feel that impact as well. And we thank you for what you're doing, and we continue to encourage you to engage with government for the betterment of the sector, as well as Nigerians who are the receiving end or who should be the final beneficiaries of all of these. Thank you very much for your time on the program.